This is a warm greeting from the Emirates Society of Ophthalmology. Welcome to the ESO 2025 ESOcast.
Thank you.
So I'm delighted to have you today, Professor Lars Holm, Senior Consultant, Head of Cataract and Refractive Surgery, Head of Surgical Facility at University Hospital of Copenhagen, and Associate Professor of University of Copenhagen as well at Denmark. Welcome, Professor, to ESO 2025, to Abu Dhabi and the UAE.
Thank you so much.
So let's start by asking how you find the conference so far.
I like this conference very much. It's smaller compared to the European counterpart, and it's also smaller, of course, to the American. But small conferences are often very good because they can offer something different. They can offer usually better dialogues and also networking, which is a very important part of a conference, is sometimes easier when you have a small conference compared to a larger one.
Yeah, I agree. Tell us about your participating in ESO 2025.
Well, I'm here presenting the European Society of Cataract and Refractive Surgeons, and I am going to present two talks, one on dropless therapy and one on the post-operative therapy after cataract surgery, which both talks are based on the guidelines that the European Society has just released.
Quite interesting topics.
Mm-hmm.
So, in your opinion, what is the importance of moving toward dropless cataract surgery?
I think it has a lot of potential benefits. We don't know yet whether it's better, but there's a very important study right now that is going to be published, and that study came out from the ESCRS. It's called the EPICAT study, and I'm going to talk about that. And I hope a lot of the participants for the ESO 25 will come and listen to that one.
Do you think it will be a common practice later on?
If we find out that pressure spikes is not a problem, I think it will become very popular. Mm-hmm. It has a lot of benefits.
Mm-hmm. Mm-hmm. Can you tell us about these benefits?
Well, the benefits is that the compliance for the patient is 100%. So compliance is not a problem. You have a fixed dosage because you're not dependent on how the drug penetrates through the cornea. There's no stinging, which is a problem for the NSAIDs, and there's no problems with allergy. So there's a lot of potential benefits of having a dropless therapy. There's no need either for home nursing if you have a patient that needs assistance for eye dripping.
This is quite interesting. Based on your experience for routine cataract surgery in normal eyes, what the key factors control post-operative inflammation? And what do you think? Do you have a patient you will feel that if I do the surgery, I think I will have more inflammation than the other patient?
So the key factor is to be gentle. So the key factor is to do good surgery. Don't touch the iris and use a low amount of energy, low amount of water. And then what is most effective to reduce the risk of cystoid macular edema has been found to be the NSAIDs compared to the steroids.
Mm-hmm. Mm-hmm. Okay, if we go away from cataract, what do you think artificial intelligence will impact eye surgery in the future?
I think it has a lot of potential benefits. It has taken a long time before we actually have seen any benefits up till now. It's very much being restricted by the GDPR because it's difficult to make research due to the GDPR legislation. But I hope it will really give us some potential benefits, reducing the workload for physicians with the demographic challenges that we are facing.
Yeah. Another question about one of the trend now. What do you think about this trend, keratopigmentation, changing the color of the cornea by putting a pigment within the cornea through femto laser?
I think it's. I'm really much against it. I think we as physicians we are obliged to focus on eye diseases because there's a lack of eye doctors, and we should focus on visual problems and helping people to preserve the vision and not destroy the eyes.
I agree. Totally agree. So let's take a step back to your journey. What inspired you to become a doctor and an ophthalmologist?
Well, as a lot of things, it was mostly actually a coincidence. I could have become engineer, anything. So I don't have really a good answer for that. An eye doctor was also coincidence. I met a very charming ophthalmologist that I saw I looked up to him. So that was why I became an ophthalmologist. It could also have been a general surgeon.
But you tend to be a very successful ophthalmologist also.
Yeah.
This is great.
Well, it's a matter of also seeing if you have a good leader in your department that you can look up to, and it's always motivating then.
So many people will ask themselves what doctors do in their free time, because they only see us in the hospital busy. So what do you do in your free time?
I have a big family with 3 kids. That takes up a lot of time. But in my free time, I like going sailing. I have a sailboat. And then because Denmark is surrounded by the sea, we have a lot of islands in Denmark. And I also like going skiing. After this conference, I'm going directly to Norway for skiing. I have a dog, and then I like to do research and so on.
This is great. Is this your first time to UAE?
This is my first time to Abu Dhabi. Yeah.
Hope you enjoy and you like the weather.
I like it very much. Yeah.
I hope that
the
you
weather
have
is
time
good
to go through the city as well.
Yeah, I just had the time today to see the Louvre.
Yeah. This is one of the best place to go. So thank you very much for sharing your thoughts, and welcome again to ESO 2025.
Thank you so
Do you
much.
want to end up with any talk?
Well, good luck with your conference. I really think it's well organized, and congratulations with the conference.
Thank you very much.
Okay.
Thank you.